My case study is on common iliac artery aneurysms. So some patient history. It's a 76-year-old male with a pulsatile mass in his left lower abdomen. I found this case study on ultrasoundcases.info. I'm not in the vascular lab at my clinical site yet, so I just acquired this one this patient's information from online, and his pictures later on in the slideshow. So some pertinent information. The pathology of a common iliac artery, it may be caused by arteriosclerosis, trauma, connective tissue disorders, and fibromuscular dysplasia. There are a few pathological differences between aneurysms of the iliac arteries and aneurysms of other major vessels. So it just means that common iliac artery aneurysms don't really differentiate from other aneurysms structurally. Incidence: common iliac artery aneurysms are the most frequent occurring of the iliac artery aneurysms, but they are typically rare in occurrence. It only accounts for roughly 2% of all abdominal aortic aneurysms, which isn't a huge amount considering they're the most frequent. Etiology: the etiology of common iliac artery aneurysms is unclear. However, some studies have shown that tuberculosis or syphilis may play a factor in the formation of aneurysms. I was only able to find one source that was able to state this, and I found it interesting. I'm curious why other research articles haven't taken this into consideration and looked deeper into it to see if tuberculosis or syphilis really could play a much larger factor in the formation of these aneurysms. The physiology of common iliac artery aneurysms is that they may appear as true aneurysms or as pseudoaneurysms. Most iliac artery aneurysms are pseudoaneurysms, and the pseudoaneurysms can be associated with pain and swelling in the abdominal region where the aneurysm is located. It could even be a pulsatile mass in some cases, but also there are the rare occasional cases where they may be asymptomatic, even if it is a true or a pseudoaneurysm. The course of disease: the walls of the common iliac artery weaken, either due by age or other underlying conditions, as previously stated, such as the arteriosclerosis, the infection, trauma. It could also be such as an autoimmune or acquired disease or an injury, and then studies have shown that it is reasonable to assume when an aneurysm is about to burst, it can be correlated to its size, which I think makes sense. The larger an aneurysm gets, the more pressure it's putting against the vessel wall, and only so much pressure can happen, such as with a balloon, that sooner or later it'd have to burst if it keeps getting larger and larger. Treatment procedures include open surgery, stent grafts, change in lifestyle habits. That could consist of losing weight if you're obese, stop smoking if you currently are, exercise more frequently, and then endovascular therapy. The prognosis: even though common iliac artery aneurysms are not very common, they are associated with having a high mortality rate of about 80%. Sometimes that is due to the patient just either being asymptomatic and not going to the doctor until it's too late and the aneurysm burst, or again just being diagnosed too late as a high association with not treating said aneurysm. The differential diagnosis of a common iliac artery aneurysm is a retroperitoneal hematoma. Just depending on the size and location, they could easily be mistaken with a iliac artery aneurysm. So, just as a discussion, the common iliac artery aneurysm are some of the rarest aneurysms, but the most common of the abdominal aneurysm classification. Once ruptured, they have a high mortality rate of about 80%. Common iliac artery aneurysms may appear as true aneurysms or as pseudoaneurysms, the pseudoaneurysm being more common in the occurrence. Treatments include lifestyle changes, such as said before, losing weight, quit smoking, quit drinking, being more active, medications, and surgical stent placement. A differential diagnosis of common iliac artery aneurysms is the retroperitoneal hematoma. I found this image. I thought it was a good diagram of how the blood flow in a common iliac artery, how it's affected and how the turbulence and such occurs and the velocity. These are the images from the ultrasound cases.info, the 76-year-old male. It's the picture of the aneurysm. The vessel's extremely dilated, measuring 5.3 centimeters in transverse. The other image on the left is the longitudinal image. This is what a normal artery should look like and measure. These measurements are long, but just in general, it's a lot smaller than the 5.3 centimeters. These measure at 1.6. This shows the Doppler put on it and the blood flow. It's extremely turbulent. And this is what a normal artery should look like with Doppler and color flow. Without the aneurysm, just the size difference is immense. And then there is this just a different modality picture to show how dilated and huge this aneurysm was. And then my works cited. Thank you.